what I've been asked to talk about is leading in a crisis and also our department. And it's a privilege to live here in Baltimore, Maryland. It's a small city by many comparisons. Even in the United States, it's about 850,000. It's quite historic because it was very instrumental in the Revolutionary War of the United States. We have quite a diversity of entertainment and athletics and history, although it's short by your comparisons. Johns Hopkins became known in 1888 by these four individuals: William Halstead, William Welch, Dr. Osler, and Dr. Harvey, or Dr. Kelly were the four founding fathers of Johns Hopkins. And Dr. Osler, who's known across the world for the father of medical education, taught us that he who studies medicine without books sails an uncharted sea, and he who studies medicine at all does not go to sea at all. And this is important as we go forward, because we think about orthopedics, and our purpose today is to really talk about all of this. And Johns Hopkins himself willed into existence 13 acres of land that now constitute our hospital. And our hospital and our medical education and our School of Medicine are founded on the ideals that all people are entitled to care. And he made it a stipulation that everyone that could come to Baltimore could come to Johns Hopkins, regardless of how they could pay for this. And we've been around for 107 years. And William Baer was trained by Dr. Halstead. Was our first orthopedic resident started in 1914, and he was Dr. Baer was our chair for many years, and then Dr. Robinson, who I have the privilege of holding the title. We became a department in 1973, and we celebrated our 100th anniversary in 2014. This department is approximately, now we have 38 clinical faculty, and we have 31 residents every year. We have many nurse practitioners and physician assistants who help us, and we have quite a robust research facility. The mission of our department is to improve the quality of life for people with disorders of the musculoskeletal system, and providing compassionate contemporary medical care, and then teaching that to our residents, to our learners across the program and across the world with our Hopkins founder. And we focus this on several areas of specialty. And today we're going to spend some time with each of these in several talks. And so that's the most important part of our message today. But what I'm going to just briefly go through are some of our divisions. Our foot and ankle division, and Dr. Ayer will be speaking. And in our hand division, Dr. Nguyen will be speaking. And in our joint arthroplasty, we've got, of course, Dr. Thakur, and we've got a great group here of one of the leading programs in the country. In oncology and cancer and tumors, Dr. Levin and Dr. Morris. And then in pediatrics, as you know, Dr. Varghese will be speaking. And I think that we're very proud of our shoulder division, because we have one of the foremost leaders in reverse shoulder arthroplasty with Dr. McFarland, and one of the most exciting leaders in orthopedics. And Dr. Srikumar will be speaking today as well. In our spine division, we've grown rapidly, and Dr. Amit Jain is going to speak to you as well. And you'll hear some introductions more about each of these individuals as we go forward. We have a robust orthopedic trauma division, and Dr. Shafiq will talk about some cases from this division as well. And I always have to be proud of our research team, which has got one of the largest funded grant for portfolios in our country, and we research across the world. And Dr. Shu Chow is the leading orthopedic researcher in the United States. And so now I'm going to talk a little bit about leading. We've all faced and our lives have been changed because of the pandemic. And this pandemic hit us in March. The first cases came into Baltimore in March of 2020. And for the last literally 2 years, we have been facing this as the whole world has changed. This was a scope done by Johns Hopkins and the modeling for forecasting what's happening in March of 2020. When it first hit the United States, there were 147,000 across the world reported. And in March, in the United States, we only had 47. But by the time we realized that this was going to be a global pandemic, we realized that in orthopedics, we had to continue to take care of these patients. And so we sat together as a leadership, and many of the people on this call and this presentation with us decided how we were going to take care of patients and continue to do so. We watched the world. We watched what was happening in China, what was happening in India, in Italy, many places where this was affecting not only our patients, but our families and ourselves as well. And so we just decided that workforce protection was the most important aspect. In order to be able to take care of patients, we had to be healthy as well. And so we started 2 different teams, and we led those 2 teams in alternating courses, and we looked out for each other. And then when we started back away from elective surgery, we brought back elective surgeries. We had seen over 290,000 deaths in the across the world, and 82,000 in the United States. And we're now over 3.5 million people dead, and it continues to impact us. And so Dr. Thakur asked me to talk a little bit about leadership, and leadership is something that Dr. Weinstein talked about. Dr. Weinstein was the president of the American Academy of Orthopedic Surgeons and is a tremendous icon in leadership. And I underlined the points that are important. I've learned and admired successful leaders who never lose sight of the fact that success is never achieved alone. It's a team, and it's because of the generosity of those who are mentors and those who have supported us. And we continue to support, and we say thank you to those who have helped along the way. And Dr. General Colin Powell, who recently died in October of 2021, noted that perpetual optimism is a force multiplier. And optimism is who we are. It's something that infects positively our teams, our people, our patients. And so leaders who whine or blame engender those same behaviors in their colleagues. And so I believe that leadership is about being an umbrella in supporting people that can do great things when you keep the water off of their heads. And so I think about umbrellas and quicksand. And then many times we talk about some of the areas where we get bogged down. And many of these are in areas where we've not maintained professionalism. I don't believe professionalism is the same as leadership, but we have to teach both professionalism and leadership. And we develop it just like we would skills, surgical skills, understanding knowledge, understanding to perform both leadership and surgery. And then we commit to excellence, and then we regulate this, and we watch and we track and we hold each other accountable. They are interrelated. And so one of the leaders, the historic leaders in orthopedic surgery, Dr. Richard Burton, who was at Rochester for many years and became a dean, publishes a book about leadership. And there are several leadership styles. Coercive is the command or the controlling type of do what I say, doesn't matter what it means. Authoritarian is coming with me and doing as I do, but I'm the boss. And affiliating is when we think about people first and then the mission, people first. Democratic is more about discussion and votes, and it takes longer time, but it gives everyone a voice. And pace setting is if you're moving fast, and keep up with me. And then finally, coaching. And coaching really constitutes professional development. And Dr. Levin, who's going to speak with us, also is our vice chair of professional development. And his job is to help all of our faculty to become better, to become leaders and develop into more than what we can see. It's hard to teach. There are many books. There's over 100,000 books if you do Google about leadership. But it is often done informally. When we as faculty and you all as surgeons work with teams, you also learn you practice and you become better there's a formal education with curriculum and organizational leadership. And there's many aspects. This is a classmate of mine from the U.S. Military Academy, Dr. Dean Taylor, who has done this at the Duke University in a formal education. We also have a formal leadership development program in this. And then our academies, our specialties, set up organizational leadership initiatives. And these are important and these are valuable. And I think these are something that we find unique. Here at Hopkins, we apply this with something called team steps, because leadership begins with a team. The captain is not always the controlling, enforcing person, but is a member of a team that is critical. And so team strategies to enhance and perform safety and performance are something that are deeper than a 5-minute conversation or a 10-minute lecture that I've been privileged to give you. But these are some aspects that I think we can talk about perhaps in future times. A team is anyone that it constitutes two people, whether it's a volleyball team or a soccer team, or as you say, football. So these are important aspects to have a dynamic, interdependent, adaptive group, that we have common goals, and that we have a time-limited membership. And it's very much common with our teams here in orthopedics. And why is teamwork so important? Because it reduces clinical errors, improves patient outcomes, process outcomes, patient satisfaction, and reduces malpractice. Our barriers to team performance are almost always about communication issues. Our time is short, our alignments are different, but all of these aspects lead to conflict, lead to misinterpretation, and lead to lack of role clarity. Effective team leaders effectively promote communication, and then they facilitate good teamwork. They make decisions through a collective input, but it often is not a democracy. So in the fact, we get as much information, we organize the team, we articulate clear goals, and then we play hockey, which these are some important features in transformational leadership. Tim Duncan, who was a friend of mine when I was in San Antonio and was known as one of the most foremost leaders in the National Basketball Association, was a humble person. There was a psychology major in college, but understood how to care for the people that he served. His leadership was a serving style. He had integrity, and we think of facilitation so that we can do what I'm about to do and hand this off to my partner, Dr. Thakur. Leadership, as we said, is a force multiplier. Optimism is something that we all have to do. I said this before because it's so important to us. There's many books. We don't learn by books, as Dr. Osler told us. We learn by patience. And so what we're going to share with you today are some ways that, or some patients and some experiences that we have had. And it's a great privilege to look outside in the snow that we recently had here in Baltimore, and to just be appreciative of the time that we've had with you. Thank you.